Hello, I'm Dr. John McNulty. Before I discuss a possible surgical treatment for you, I'd like to tell you a little bit about myself. I was born and raised in New York. I graduated from Columbia College of Physicians and Surgeons, where I earned my MD degree. I also did my postgraduate surgical training in New York City. In 1990, I started private practice in North Dakota. I've been board certified since 1994. I relocated my family to beautiful North Idaho to enjoy the outdoor lifestyle in 1998. Since then, I've been practicing at Shoshone Medical Center in Kellogg as well as Benoit Community Hospital in St. Mary's. I have office hours in Kellogg as well as St. Mary's to provide convenient follow-up care. The arthroscope is a minimally invasive means to evaluate and treat joint problems. A small fiber optic tube is placed in the joint while the surgeon watches on a monitor. In the shoulder, rotator cuff tears and bone spurs can be evaluated and treated. In the knee, meniscus or cartilage tears can be removed using small instruments. I perform a wide variety of surgical procedures, including total joint replacement. Total joint replacement is an effective means of treating badly worn arthritic joints. Metal and plastic components are inserted into the painful joint, often decreasing pain and improving function. Here's an example of a knee prosthesis. Precise instruments are used to insert these components. The same is true for a hip prosthesis. The patient is now walking on metal and plastic instead of the painful joint. In select patients, minimally invasive techniques can be used. Treatment of carpal tunnel syndrome and trigger fingers are common hand surgical procedures performed at Shoshone Medical Center. The outdoor lifestyle in North Idaho is conducive to numerous recreational injuries. I provide surgical care for those fractures or broken bones that cannot adequately be treated with a cast. This model demonstrates a fracture stabilized with a plate and screws. The fracture pieces are held together, allowing them to heal properly and in good alignment. This X-ray demonstrates a severe shoulder fracture stabilized with a special plate and screws. This provides a rigid fixation, allowing early patient movement. Next, we're going to discuss surgical treatment of torn cartilage in the knee. The meniscus is a cartilaginous shock absorber in the knee. Injuries to the meniscus are very common. The arthroscope is a minimally invasive means of removing the torn cartilage. 2 to 3 holes are placed in the knee. The knee is inflated with water. The arthroscope is used to identify the torn cartilage. This model demonstrates what a torn cartilage would look like. On the other side of the model, the shaded area demonstrates the removal of the torn meniscus. The meniscus is rounded off so no sharp edges are present. After surgery, an analgesic is injected into the knee. The patients are usually able to walk the day of surgery. They use crutches or brace for a day or two. However, crutches and brace are usually optional. I hope this brief overview was informative. I have office hours in Kellogg and St. Mary's to provide convenient follow-up care. If you have any questions, please contact me.